be up to date with the forum, and if anything pops up, I'll be sure to be attentive.
Okay, cool. I'll let her know, and we'll send out probably like a summary at the end of the meeting. So
Sounds good.
works. Have a good evening.
You too. Thank you. Bye.
Hi, Ariel. So do we need meeting minutes as well as the video?
Probably wouldn't hurt if somebody wants to take them down.
Yeah, I can do that part. I just didn't want to commit before I tested out my technology here, making sure I could link into you guys. But I can type them up as we're kind of talking.
Okay, that works.
I didn't know how specific she wanted our topics to do, like if we needed bell numbers or just what state and what the topic was, just to come to a common ground, I guess, on topic report topics.
Yeah, she's not very specific on anything, it sounds like.
Yeah, I'm gathering that, this paper that we're writing at the end of the semester is a group paper we're all contributing to, or is it something we're each doing ourselves?
I'm pretty sure that it's a group paper that we're all contributing to.
Mm-hmm.
So
Okay.
that should be pretty interesting.
Yeah, I guess we'll have to at some point. I have, just from writing other papers I could put together, like the template of it, and we could all maybe pass it around through email. I guess that gets tricky if, something gets erased or, the formatting gets jumbled up. But
Messed
I guess
up.
that's how it goes, I guess.
Yeah, someone else asked, I think, on an open comment and mentioned, like, do we all have to submit something? And she said, no, it's just one person.
Okay.
So.
All right. Well, we can figure that out.
Yeah.
As time goes on. But okay, let me see if I can get Word document up, and I'll just start typing what we were talking about already.
Okay. I think we started at 7:45, a little bit early, so. I was really getting on here to like play with learning how to record it and save it because I'd never done that before.
So how did you set up the meeting? You went into the app or to the program and it's self-explanatory, or?
Yeah, I just went in and made the account, and then I've used it a couple of times for work purposes, so I was sort of familiar with it, but I just went in and made my own account and then made a YouTube account to load to.
Oh, okay, that's the thing. That's what I don't have. So that was Levis. Is that how you pronounce his name?
I guess. He didn't ever introduce himself, so.
So I'm assuming it was Levis.
It's the only male in the group, so.
Yeah.
Can you see us?
I can see you. I'm just on my dashboard because it's
Okay.
almost 9 o'clock at night. I got my son all ready for bed, and I got him from work late, so I'm just like a mess. But
No worries.
I didn't want that to be your first introduction.
Well, I'm going to be honest. Usually I'm like showered and getting in the bed at this point, so this is late for me.
Uh-huh.
So what do you do?
Right now, I'm director of nursing. I work at a detox and rehab facility in Pennsylvania.
Wow. No pressure there, huh?
Yeah. So already your topics are pretty interesting to me, because that's kind of what we do.
Yeah. And I was there's a lot of information on it because I was kind of thinking about as far as just trying to get as far as ease of writing the paper in itself was mainly just trying to make sure there was enough information, because when I was reviewing the template, a lot of it was, making sure you had alternatives and you had places where this has been done. And so there was just a lot of information about telemedicine just easily available. So that's kind of why I thought about it as well.
Okay.
So as far as just ease of writing, and Louisiana's pretty screwed up in everything healthcare. So
is it?
everyone else pretty much does it better. So
So we have Katie, Amanda, Ladaria, and Hannah, I guess that'll be joining.
yeah, and the meeting is it only allows us to do this for 40 minutes to record the first one.
Okay.
So
So this is it's already going.
yes.
Gotcha. Okay.
So we'll just have to make it quick.
Mm-hmm.
I went ahead and answered the 2 questions that we have to do for each proposed idea. I went ahead and answered both of those for both of mine just to make it easy
Okay.
for whoever decided to do it.
So why don't I get your, I guess we could share ours while, since we're recording. Let me get Levis's info in here quick here.
That's fine. And they should be here shortly. I'm sure they'll get on quickly.
And what do you do?
I'm a practice manager for a heart failure cardiology clinic, but I'd been a nursing facility administrator for 5 years prior to that.
Okay. All right, nice.
So I understand the 24/7.
Yeah. Yeah, I'm having, today was we had a couple agency nurses that are caught, it's just in a bad situation right now with some staffing, and it's just occupying my day here.
Staffing is a never-ending problem.
Mm-hmm.
Y'all just have RNs and LPNs, or?
Yeah, I guess, I mean, we do have a few LPNs, but we're moving in the direction of having all BSN prepared nursing staff right now.
I feel like it's going to come to that one day.
Yeah, it's a slow moving transition, but
Just makes me wonder, well, what's going to happen with all those people that are CNAs? What are they going to have to become?
Mm-hmm. Yeah, we had a hospital up in our area that they became magnet certified, so they did actually require their LPNs to either, go back to school, or they would be laid off pretty much. So they gave them a time frame where they had to get that done.
Wow.
And it was a big upheaval. I mean, it was a complete turnover of hospital staff.
How did they afford that?
I honestly don't know. And they're nonprofit. They were nonprofit. But,
Wow.
It did change the culture, just the, the overall culture as far as like evidence-based people that were more committed to that kind of change.
They'll probably see the benefits, no doubt.
Yeah, you had a lot of, staff that maybe they had been an LPN for 30 some years, and they're now in the end of their career. They're not wanting to go back to school at all. And it was just a shame to let go that many, because they're more experienced. I mean, honestly, with that kind of longevity, you have more experience, than some of the new
More than a book can teach you, that's for sure.
Yeah.
That's crazy. Yeah, it was a blessing to get out of the 24/7 365 gig for a while.
Yeah.
I was welcoming the 8 to 5.
Oh, I bet. So you're almost done here with your degree?
I'm halfway done.
Oh, nice.
Hey, how are you?
Hello, it's Ladaria.
Hey, Ladaria.
Hi, it's Jacelyn.
Hello.
We're waiting on a few more. Levis got in early and gave us his information and had to get off, so we started a little early.
Okay.
So he had medical marijuana from, let's see, what state did he say that was?
Ohio,
And then he had the opioid epidemic.
in Ohio, yeah.
And I'm sorry, I didn't really get what his policy, the policy focus was on that one.
I'm not really quite sure. No, I'm sorry, opioid was with medical marijuana. He did the abortion was the
Oh,
first
that's
one,
right.
was the first one.
Okay, you're right.
Preventing late-term abortions. Which I'm not really sure that that's applicable because they don't allow them there.
Mm-hmm.
I'm not sure how. I might have overanalyzed. I actually got like law statute number.
Yes. Yeah, so what did you have? What topics did you bring up?
The first one I had was actually have like the statute code, and it was physicians who hold unrestricted medical license and who practices telemedicine are required biannually to conduct an in-person patient history or physical examination with those patients' prescribed controlled substances. That would be my proposed change.
Okay.
Because as of right now, Louisiana ranks number 10 in opioid-related deaths.
Okay.
And as of right now, the policy is they're not required to be seen, nor have a previous established patient relationship.
All right. Again, I'm just typing up, as best I can our minutes here. It's not like a court stenographer by any means here. So, and then you had any other topics to share?
Yeah, I had Medicaid recipients or their parents or legal guardians are required to quarterly submit proof of medical and pharmaceutical physician directives compliance for continued health benefit coverage.
Whose guardians submit? What was it?
Either the recipient themselves or their legal guardian required to submit proof of physician directive compliance. So pharmaceutical, like medicines on time, correct medicines for
Okay.
continued health benefit.
Okay.
Because Louisiana ranks number 5 in diabetic related deaths, which directly correlates to the rate of Medicaid recipients diagnosed with diabetes, as well as failing to attend primary care physician visits and properly conducting lab tests.
Okay.
And we never have enough money to fund anything, so. Critical hospital or emergency visits are expensive, therefore it's draining the system.
Mm-hmm. Okay, so it's 9:01.
Hey, Mandy.
8:01 for you guys.
Yeah, we're ready.
And we started at, what was the official start time?
Like 7:40.
Okay. Alrighty. Okay, and did you have anything else, or was that it for your topics?
Those were the two that I had, yeah.
Okay.
Ladaria, you wanna go next?
Sure. The first one that I have, it was about the opioids and substance abuse in Texas. We actually have an alarming problem here. Nearly 3,000 Texans died from opioid and other drug overdoses in 2017. But the problem here is it's a funding issue as well. They said it could possibly cost $931 million to tackle the state's problem, to try to get some kind of funding for that to help Texans with substance abuse. And they were talking about including the Good Samaritan law to legally protect people to help someone who is overdosing. Go ahead, I'm sorry.
No, that's interesting. Yeah, I'm typing and listening, so go ahead.
And then my other one was the Medicaid issue. We're having a problem here with funding for Medicaid. And the biggest thing that they're doing right now, they're still trying to, we have a funding priority for the Hurricane Harvey recovery still, property taxes and school finances. So that is, that's causing a problem with us being able to fund Medicaid properly.
Mm.
And doctors are pushing for higher reimbursement rates under the program.
So what would be the, I guess, your proposed change to fix those? Because that's
for the opioids and substance abuse, I would say, I think enacting the Good Samaritan Act would be good, the law for that. You know, if we're putting more effort into trying to help these people instead of just letting them overdose, you know what I'm saying? Especially if the state doesn't have the funding to get it done.
Do you have warm handoff centers in your states?
You know, I didn't even check into that.
Warm handoff programs in your ERs? I was just curious.
I didn't even check into that.
there seems to be a trend in our group with opioids.
Yeah, nice. All right, I like it.
I think we were just kind of talking, Ladaria, I don't know if you've looked at the criteria for the paper itself.
Uh-huh.
But it's very specific as far as like requiring like alternatives to your proposed law, and it's very specific. So Jocelyn and Levis and I were discussing that we probably need to think kind of broad on the topic that we pick as far as the information that's available for it to help us to do it. I don't want to get, too broad as far as, and then not have enough information or not be able to narrow it down small enough. Funding scares me. I'm going to be honest. Money, anything financial, I feel like that opens up a can of worms that that scares me. I don't know about y'all, but that's just me. That's not something that I would pick personally. So,
Gotcha.
Yeah. So my topics were revolving around mental health and substance abuse also. So one was, let's see, this was Maryland. It was a Maryland bill that's in progress. So it's regarding correctional services and opioid use disorder. So it's requiring correctional facilities to conduct assessments, mental health and substance abuse assessments, and the status of inmates, using evidence-based screenings to determine if, number one, they need a diagnosis, and then also if medication-assisted treatment can be appropriate. So, like your Vivitrol, your sub-maintenance, your methadone treatment. So making sure, that that's being looked at holistically for the inmates. The other topic I had was Colorado. These aren't Pennsylvania related necessarily, but I think there's a lot. These things do present themselves in our state as well. This is individuals at risk of institutionalism. So it's developing measurable outcomes to monitor efforts to prevent Medicaid recipients from becoming involved in the criminal justice system, and working collaboratively with managed care companies to create incentives for behavioral health providers to accept those Medicaid recipients with severe behavioral disorders. And the third bill was out of Maine, and that was an act to support early intervention and treatment of mental health disorders. So catching mental health disorders earlier, in young adulthood to prevent lifelong incorrect medication regimens and just mistreatment and misdiagnosis in general.
That's a kind of a snowball effect, that one. That's probably got a lot of information on it.
Yeah, definitely.
That's a good one.
So, all of those things they're things I'm seeing in my current position and just in my work experience here. So I think it wouldn't be difficult to dig up some information on those topics.
Right. That's very true.
Right.
Hey, Mandy, I don't know if you can hear us.
Hey, I'm sorry, was I late?
No, it ended up, we got on, I started to just trying to practice doing the recording thing, and then Levis was on and he had to get off, so we went ahead and started it because he had to leave. So
Okay, all right.
It's been like a piecemeal, so it's fine.
No problem.
So Jocelyn went ahead and started taking down just kind of some minutes for us. And then I figured once we kind of discussed the topics that we had, we could email those to you.
Okay.
And I think we all kind of maybe over analyzed and did a lot more work than we had to, but that's good because it should be pretty easy to put it together.
Mm-hmm.
So I don't know. We've all gone through ours. So if y'all, you and Hannah want to go through y'all's too, then that's great.
Yeah, so I can go real quick. I know y'all said there was a common theme with opioids. I actually did not follow that theme. One of the things that, and it's kind of just personal to me, is nursing ratios. And I'm a nurse by background, and it's why I'm not a bedside nurse anymore, honestly. So in Louisiana, I live in Louisiana. California is the only state that has a true nurse ratio law. And I think in Louisiana, we could benefit from that. I did look at other states. Nobody else has an actual law, but there are alternatives that other states have enacted. So there is that part of that too. And there's some really good research information that I've been able to find on that, if we were to go that route. So that is number one. And then number two, I work in telemedicine now. And so one of the things that Louisiana has, which is great, is a parity law for commercial payers to pay for telemedicine visits. And however, it is only specific to physicians. So any APPs or PAs or any other providers that are providing telemedicine care, it allows for commercial payers to opt out and not pay for those visits. And as healthcare is moving towards telehealth, it's going to be really important for us to pay for those visits. And then also as part of that, it's a specific statute in the so it's very specific. It's it says only 75%, up to 75% has to be paid. There's some, and that one was kind of just more personal to me because I'm in the realm and we're kind of dealing with that on a day-to-day basis. I'm not sure that anybody would even be interested in researching that. But I have done a little bit more research on that too. And, we could talk more about it, but that's kind of just the basic one. The nursing one is kind of more important to me. So if I had to pick one of the two, that would definitely be the one that I would say probably is a lot more broad and has a lot more options to really dig and pull things. But,
right. I'm from Louisiana as well. So it's funny because one of mine was, I was just telling Jocelyn, mine was telemedicine related as well.
Oh, cool.
Yeah. So
what is it? I'm just curious.
I'm requiring, I was going to suggest that physicians must be required to do a biannual in-person visit to prescribe controlled substances because right now they don't. So there's a lot of information, I think, on telemedicine in general just because it's really booming. So
yeah,
that may be a good one.
Yeah, definitely.
Those are good. Those are really good. Hannah, hey, how's it going?
Good. How are you?
We're well. I think you're gonna wrap us up.
Okay, cool. So I wasn't sure how specific or vague to be, but so I'm from Florida, and I know that one of the big issues right now is that a lot of prescription pills are getting more and more expensive. So the point where people are well, old people, but are getting kind of frustrated because they can't really afford it on their fixed incomes. and like my grandma's one of them. So she's like kind of stopped taking some of her prescription pills because she can't really like afford like the price increases, I guess. So, and being from Florida, it's like all old people here. So it's like especially a big issue here for us. And then just another one that I did. Also with, again, with how like, well, because I was looking at like the statistics of Florida, and like we have like one of the highest population percentages of 65 and older in like the entire country. So I was like looking for problems with like the older population, and they're looking to like cut the Medicaid, Medicare budget for Florida, which a lot of people rely on here. It has a significantly higher budget than like any of the neighboring states and like most in the country. So if they do that, that would like, in addition to the increase in like the prescription pills prices, like that would also be bad for them, I feel like. So I don't know.
Less
Maybe
coverage.
they could go together. Yeah, I don't know.
Yeah.
Or whatever.
Yeah. All right, great.
Those are all really good suggestions. I feel like we're definitely on the right track for sure.
Yeah, definitely.
So I guess let's kind of, I guess, take a group consensus, because we have to narrow it down to 3. So it's kind of, there seems to be a Medicaid theme, there seems to be an opioid theme, and you know, so it's I'm okay with whatever the group wants to do, at least for those 3. So
I like the telemedicine because I think that would allow us to, you know, kind of wrap a lot of our different topics in there, because you have, we're starting to do telemedicine for 24/7 detox and rehab admissions. You're doing, you know, you're seeing the telemedicine visits for outpatient psychiatry or PCP prescribing controlled meds. And then Mandy was talking about, you know, the commercial laws for payment reimbursement. So I think we could really, you know, as far as a 10-page paper goes, I think we could really take that in a lot of different directions.
I think if you take the telemedicine kind of lumped in with the opioids, that really gives you kind of both avenues to go down as far as writing, you know what I mean?
Mm-hmm.
So how does everybody else feel about that as well?
Yeah, it sounds good.
Good.
Okay.
Okay. So if we want to do, you know, one of those, and then maybe a Medicaid one as well, because we have to pick 3. So
Yeah, that and Medicaid is a big one, or the nursing ratios too. I think we could probably.
that's a good one.
Yeah.
We could go on and on forever about that.
We were talking about that before you got on, Mandy. We were discussing that, and in her place of work and nursing homes. So you could really go a lot of places with that.
So we want to do telemedicine / opioid epidemic and funding, like Medicaid funding and nursing ratios.
Yeah, I think we actually need, on whatever we submit, we probably need the specific statute that we want to change as far as that, because she seemed pretty particular about that.
Yeah.
So we would definitely want to, on mine, I got the statute code. So yeah, whoever we decide may want to look theirs up as well and send that to Mandy.
I'll put mine in the minutes. Mine was a Maryland bill. Is that what yours is? It's a bill?
Yeah, mine's actually a law. Yeah.
Okay.
Mine's actually an existing law we would be changing.
Okay. So I'll just include, what's yours?
Let's see. It is RS 37:1271 Louisiana law.
Okay. Then I'll throw mine in there. What about the other 2 topics?
That's Mandy's, is the nursing ratio.
Well, I think the challenge with the nursing ratio is there's nothing truly in existence.
Right.
It's more just kind of an acting.
What if we reference that California one you were talking about?
Yeah, we could definitely reference the California one for sure. Yeah, I can, and I'll look it up. I saved it somewhere. So
Yeah,
Okay.
it's a good bookmark.
Gotcha. I'll throw that in there. And then the Medicaid, was there anything we had? I forget who brought that one up.
Tina did.
Yeah, I don't have one, but I'm looking it up right now.
So we can get that rolling. And then I guess, Jocelyn, if you want to send that out to everyone.
Do you guys want to, have this just be a draft, the minutes, or do you want me to just post it into the forum?
I mean, it's not submitting it for a grade, so I guess it really doesn't matter.
yeah.
Okay.
It's just
Alright.
for what we talked about.
I think the only other part of the brainstorming assignment was to put the state in which in what state is your team interested in this policy issue. So, I mean, I know that we're from Louisiana. Is there another state that we want to that we want to focus on? Hannah, I think you said Florida for the Medicaid, so we can do Medicaid Florida. I mean, I know nursing ratios. We could really talk about any state most at this point.
I said we just focus on whatever issue the state it came out of. We just focus on doing it there.
Okay, perfect.
Because Jocelyn was from, you said Maryland, right?
Right.
Okay.
Okay. All
That
right, guys.
works. That works.
And we did not meet with Katie, is that right? Just so I have this correct?
Right.
Okay. All righty.
So are we turning in like a typed up paper and the recording like for each person, or just one person from the group turns it in?
Just one person.
Okay, so I don't need to turn anything in then, or like work on anything. Just look up the like healthcare policy and post it in the forum.
That's
Yeah,
right.
or you can email it to Mandy because she's going to be putting together the actual document for the brainstorming to submit for us.
Okay.
So if
Mandy,
you want,
is your email in the forum?
Yeah, I put my email in the forum, and then I'll send it out to the group in an email before I submit it. But if you look when you like go to submit stuff, it actually says group 12, so it's submitting for everyone. So
Okay, cool. Okay, awesome.
yeah.
and
Alright,
then
well,
if
I'll
we
look
need
it
to
up.
make just email it to me, and then if we need to make any changes based on what I sent to everybody, just share your feedback.
Okay, cool. Yeah.
I have a feeling that nobody really wants to work on this on the weekend, so
No.
I figured the sooner the better we could get this working. Yeah.
Absolutely.
Okay. Well, I think this was good, guys. I'm going to go ahead and try to figure out how to load this onto the thing because that's new to me. So, but Mandy, I'll shoot you my stuff as well.
Okay. Really quickly before we go, well, I just want to make sure. Somebody said they just posted like a link, and she said that was good enough. If you can't actually get the video, because I have no idea how they were talking about that, but another group posted that they just posted the link and they were fine with that.
Like the link to YouTube?
Yeah. So I guess that would work. I mean, maybe try it, but I think that's probably the easiest thing to do is just upload it to YouTube and then just share the link with them. So
Yeah, and I've seen some other suggestions about like putting it in a Word document and just uploading the Word document. So
yeah.
I'll make sure we get our credit, guys. I'll make sure we get our credit.
The other thing, do we want to look at a time for next week?
For next week?
Yeah. Do we want to, I mean, I know that it kind of took a day or two to kind of solidify, but if we don't want to, be working on the weekend, maybe try like Tuesday or Wednesday, a little bit earlier in the week to try and do it.
I think if we did Wednesday, because that gives us Monday and Tuesday for us to all kind of like read over the stuff and do our own research and then come together Wednesday, and then that gives us 2 days to get it together.
That's good.
On Wednesdays, I work until like 11:30 p.m. or so, like literally from 10 a.m. to 11:30 p.m.
Oh my gosh.
So I don't have to be there. I can send someone whatever I find if that's helpful, or like
Yeah, there was
I
a
usually
suggestion
don't.
to post your information in the forum, and we can pick it out from there.
Okay.
And if we
And then-
need to do like another meeting or something, like if you were having trouble writing and we could just do a random one, that's fine.
Yeah, okay. And then my number's in there. You can always text me. But I usually have Tuesdays and Thursdays off at night. So
Okay.
like if it ever comes to that I need to be in the meeting, I can always do that. Or if you want to meet Wednesdays, I'll just do all my work and put it in the forum, and you have my number if you ever need to text me.
Yeah, we can be flexible. And Ladiri, how does that work for you?
It's good for me.
Okay, cool.
I have my phone with me all the time, even if I have to work late, so it's fine.
Awesome. Okay.
And we'll still do it Wednesday, 8 p.m. Central.
Yeah, 8's good for everybody?
Yes.
Okay,
All right.
that works. All right, guys, we appreciate it. And thanks, Mandy, for putting it all together. So
Problem.
appreciate it, y'all. Have a good evening.
Y'all too.
That's-
Bye-bye.